as you may be aware, UNAIDS is the secretariat for the joint UN response to HIV and AIDS, and we are the lead global lead advocates for HIV/AIDS global response. We coordinate the effort of 11 UN agencies, including the World Bank, and our effort is to help countries address HIV in terms of reducing new infections, but more importantly, to ensure that people who are infected also get access to treatment. Currently, our global target is to ensure that 95% of the people living with HIV in the world will be identified, and then these 95, out of the 95% of people living with HIV are identified. 95 of them will be put on treatment, and by the year 2030, we are hoping that 95 of these populations who are on treatment would have achieved viral suppression globally. So it's the same in Sierra Leone. Currently, we know that there are 38.4 million people living with HIV globally. Last year, we had about 600,000 people dying of HIV. We've had new infections still going on. So globally, this is a priority. In Sierra Leone, the epidemic in Sierra Leone is feminized and concentrated among key population groups. Why do I say the epidemic is feminized? If you look at the country prevalence, the prevalence for the country based on the demographic health survey of 2019 indicates that HIV prevalence in Sierra Leone is about 1.7%. But if you're looking at the gender dynamics, you realize that if you take every 2 women who are infected, only 1 man is infected. So the prevalence among women is 2.2%, but for men is 1.1. If you narrow down to young girls and young boys aged between 15 and 24 years, you realize that the epidemic is 3 times higher among adolescent girls and young women aged 15 and 24 years than boys of the same age group. For boys and girls, boys in that age group, it's just 0.5%. So for girls, it's 1.5%. For boys, it's 0.5%. So you see clearly that the epidemic is centered among this population group. For the key population, because of the barriers we have, the human rights violations, the challenges of stigma and discrimination that they face, so you realize that HIV prevalence among the key population group is disproportionately much higher than in the general population. So for instance, female sex workers have a prevalence of about 11.8% compared to other groups such as men who inject drugs. It's about 4.2%. If you're looking at transgender persons, it's also about 4.2%. If you're looking at people who inject drugs, it's about 4.2%. If you're looking at MSM, men who have sex with men, it's about 3.2, and for people in prison, it's also about 3.2. So you realize that these population groups have much higher prevalence than a majority of the general population. So you ask yourself, why do we have the situation? And you realize that, like I said, it's the stigma and discrimination that these populations face. For adolescent girls and young women, it's mainly the cultural and the harmful cultural practices and the gender inequalities that we have in our society that is driving the epidemic. As you may be aware, Sierra Leone ranks 19th on the list of countries that have very high child marriage rates. So already we are sending a lot of girls who should be in school into early marriage, and because of that, they are exposed to HIV and other harmful effects of early marriage. Again, we know that many of our girls in Sierra Leone starts to have sex much earlier than boys, and the issue of teenage pregnancy or children getting pregnant before age 19 is significantly higher in Sierra Leone than in many countries. In Sierra Leone, it is believed that by 19 years, almost 29% of all girls in this country would have given birth. It increases even by a 24 years, you realize that the percentage would have increased to about 49%. So it tells you girls are getting exposed at a very tender age because of if they were in school, for instance, I do believe that they would have averted early pregnancy and also early child marriage. For the key population group, it's mainly the issues about stigma, repressive laws. For the LGBTI population, you know, we have the sodomy provisions in the constitution, in the penal code, that sentence people to more than 10 years for engaging in same-sex relationship. You have, for the drug users, the country does not even discriminate. You have all kinds of drug use being criminalized across board, irrespective of the quantity that a police officer finds on a person. He will be charged and be prosecuted, just like if you have somebody who is trafficking drugs. So that is a major problem. We don't have harm reduction interventions for drug users in the country, and as a result of that, we've seen very high rates of overdose among that population. So even though we have opioid substitution therapy in the country, we are not being able to roll it out fully because of the legal barriers. These people are gone underground, and we cannot reach them with services to prevent them from getting overdose, to protect them from dying out of overdose, or even to give them needle and syringes so that they don't share needles and syringes that makes them vulnerable to HIV. So I strongly believe these are challenges that we have. And if you look at the UNAIDS global strategy, which talks about ending inequalities to end AIDS, what it simply means is that we need to ensure that these population groups have access to services, access to HIV prevention services, and access to treatment services to reduce infections among these key population groups. But when they are already infected, then we must provide them with treatment that will give them lifelong support and reduce the possibility of they transmitting the virus to other people. So those are major things. And for the gender, on the issues of gender inequalities, I think there is a lot that has been done and we continue to do. First, I think Sierra Leone is doing much better in terms of government push to address the issues of the gender equality and women empowerment. You have the law being presented in Parliament. But from where we sit, for us, we have initiated what we call the Education Plus Initiative. The Education Plus Initiative is a joint program of 5 UN agencies: UNAIDS, UNESCO, UNICEF, UN Women, and UNFPA. The whole idea is that we need to keep girls in school, and if girls can finish secondary school, we do believe it will reduce their vulnerability to early sex and all the harmful practices I've talked about, and then make them less vulnerable to HIV infection. Under the program, which has 5 pillars, one is to ensure that girls complete secondary education. The second thing is to ensure that we can eliminate gender-based violence, which puts girls at a risk of HIV infection. Is to ensure that we have access to reproductive health services for girls. And here I need to mention the work that the First Lady is doing in terms of providing sanitary pads for girls, which is a critical element of our ability to ensure that girls stay in school, because if they absent themselves from school whilst menstruating, then it affects their performance. And also, the government under its radical inclusion have reduced, they eliminated the policy that prevented girls from going to school when they are pregnant. So we believe that with that we can ensure that girls have access to education. The fourth thing that the education plans focus on, it also focuses on comprehensive sexuality education to ensure that they have enough knowledge whilst in school, so that when they finish school, then they are not whilst in school, so that they don't engage in unprotected sex and then get pregnant or get HIV infection. And the last one is to look at HIV transitioning from school to work. And we have seen the government what they are calling the STEAM initiative that provides scholarships to girls who are interested in pursuing science, technology, engineering, agriculture, and mathematics, so from primary to the university level. If we do this, then it provides opportunity for girls as well to get into other activities that can best be described as a domain for men. And then lastly is what they are doing with the TVET, so that girls can get into things like plumbing, carpentry, which would also help girls to get work immediately they finish school. Well, coming from Montreal, one of the key things that I find very useful is that we've launched a framework. You remember, like I said, our strategy is on ending inequalities and ending AIDS, because currently the HIV pandemic challenges that we have is all because of the inherent inequalities we have among population groups, among countries, among urban, rural. So it's by location. The epidemic is now focused mainly on the inequalities that exist among population groups, and also by locations. If you're looking at the urban rural, you realize that more people in urban centers are infected with HIV than rural. We have just spoken about the population groups. So one of the key things that came up was the launch of a framework on how do we address inequalities that is driving the HIV epidemic and response globally. And we have seen that these inequalities have worsened as a result of COVID. It has worsened as a result of the Russia-Ukraine crisis. Because of the general hardship, people living with HIV and the communities we serve tends to be more vulnerable than the general population. So coming from Montreal, that is one thing that stands out. As a country, I will just run through a couple of things that we are doing in an attempt to address the HIV response. For the key populations, we working with Global Fund, we've had a 5-year human rights response plan, which is addressing the challenges we have when it comes to the inequalities issues, the stigma and discrimination, the violations that the key populations, particularly and the people living with HIV, are facing, so that we can address stigma and discrimination broadly using this 5-year plan. But we are trying as much as we can to ensure that we reduce HIV infections from mother to child transmission, which is a priority for us because Sierra Leone is not doing well. Even though we have a lot of women delivering, over 90% of the women go to clinic during antenatal. when they are pregnant, and they deliver most often in hospitals. Our performance on eliminating mother-to-child transmission is very low. Our coverage is about 78%, but if you look at the transmission rate, it's over 20%. So we have about 4% of babies being born to mothers with HIV, which is unacceptable. Our push is that by 2025 we will eliminate it to less than 5%. So that's what we are trying to work at. We are working with the lab people to ensure that we get our testing done. We're working with Global Fund to ensure that we have the commodities at places where people can get access to treatment, to prevention services. Because we believe that with the new drugs we have, if you put somebody on medication consistently for a maximum of 6 months, that person, it should be possible for this person to test negative. Not that he is cured, but it should be possible that the person will test negative for HIV. And then it means that he cannot transmit the virus to any other person. And that is the goal, to ensure that every person who is HIV positive is virally suppressed so that they become intransmissible. And in that way, we are hoping that by 2025, we would have made significant progress in that. Currently, our HIV program is largely funded by the Global Fund and the PEPFAR, the US government presidential initiative for HIV. So if you look at over the 3 years, even though the Global Fund had contributed $126 million to Sierra Leone for HIV, TB, malaria, and health system strengthening, for the HIV component, we had $42 million over 3 years. Annually, every year, PEPFAR puts about $8 million into HIV. So we have enough money to do what is needed for the country. But we've had challenges with disbursement because of bureaucracies and issues like that. So that is being addressed. But having said that, the money will still not be enough. And that's why we need domestic financing, both from government. So we've seen government budget allocation increasing incrementally over the last 3 years or 5 years since 2015. We've seen it increasing. But we do believe that the government could do more in terms of some of the cost centers that we are seeing. About 2 weeks ago, recognizing the effect of COVID on people living with HIV and the key population, we were at NACSA discussing with them how do we ensure that the people living with HIV and the key populations can benefit from social protection initiatives like cash transfer, because they are equally a very vulnerable population group. So we are looking at, and I think since that money will be coming from government or through the World Bank, that will be a significant contribution in cushioning the effect of COVID on people living with HIV and the key populations. But in addition to that, I think what we haven't done well is our engagement with the private sector. I think there is great potential which we haven't tapped, and I think it's an opportunity for us to look at. This year we want to work with ILO to ensure that we have some significant support to get the national workplace policy reviewed, and that will provide us with an entry point to go to the banks and say, look, put money into HIV. If not for the country, at least do it for your staff. We go to the brewery and say, look, do it for your staff. So that the mining sector especially, now there is a lot of illegal gold mining, and to be able to reach these people with services that protect them. For instance, just giving them condoms will protect them from getting infected, because in the mining sites, you have a lot of sex work going on in those illegal mining sites. So then they can protect themselves from infection. So it's to look at it broadly and ensure that everybody can play a role. Even the religious sector the churches and the mosques can provide support to people within their congregations, just to ensure that we are all contributing to reducing the HIV epidemic in Sierra Leone and its effects and impact on families. Surprisingly, there are a couple of things we are doing very well. Recently, the Global Fund had a publication. They are doing the human rights intervention in 4 countries. Sierra Leone came up top because we have moved much better than Cameroon and the 2 other countries which were enrolled in the program. Particularly the drug program that is led by Habib's group. They came up, even though Sierra Leone was better, they were singled out as one of the best in the region. Even though our structures haven't functioned well, the structures we've put for the key population program in the West Africa region has proven to be one of the best. We know that for what we are calling the community-led monitoring work that is being done, the network of positives, people living with HIV in Sierra Leone, has been adjudged twice as one of the best institutions that is actually being able to monitor the impact of poor quality of health service delivery on people living with HIV, and being able to report on it, but more importantly to engage with policy makers on how to address some of the challenges. So we've done well in those aspects. I also do believe that Sierra Leone response, I'm very confident that we are in the position now that beginning from now till next year, the response would have taken off again from initially where it used to be. I think we can achieve a lot than where we are now, but the potential to make a significant impact, I see it as being very timely in currently, and I do believe that we will be able to demonstrate greater results in 2023 and 2025. And if you look at the number of people who have been on treatment over the last 3 years, we have moved from 19,000 to currently 46,000. I'm not saying it's good enough, because our target is that we have 78,000 people living with HIV in Sierra Leone. We should be able to reach about 68,000 before the end of this year or next year. But where we have coming from 19,000 to 46,000 in 2 years, it shows that with the right support, Sierra Leone will be able to deliver.